Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4. Our research title is Law and Certification of Nursing Home Institution in USA. So first of all, I would like to introduce myself. My name is Muhammad Kamarul Arifin bin Muhammad Zaidi, and my metric number is H17A0127. For the introduction, as 2017, approximately 1.4 million Americans live in a nursing home, two-thirds of whom rely on Medicaid to pay for their care. Residential nursing facilities receive Medicaid federal funding and approval through a state health department. These facilities may be overseen by various types of state agencies, example, health, mental health, or intellectual disabilities. Nursing homes have traditionally been large institutions. Smaller community versions were developed around the 1970s. Some community living CL group advocate for a different type of care and fundings, which resulted in the creation of assisted living facilities. In the United States, the National Social Insurance Program Medicare was established by the U.S. federal government in 1965, which guaranteed access to health insurance for Americans aged 95 and older. This program prompted many new nursing homes to be set in the following years. Although private nursing homes were already being built from the 1930s as the consequence of the Great Depression and the Social Security Act 1935. Medicaid, the nation's poverty program, often funds programs such as nursing beds, and residents may be impoverished to access the facility. In 1987, a report examined the nursing home problem in Wisconsin, which involved 4,000 people, 80% under 65 years of age, with an average of 110 patients per facility. 5% had developmental disability. They reported that 13 large institutions were certified as SNFS skilled nursing facilities, that all were absolutely inappropriate placement for the developmental disabilities client. The federal then reported a need to upgrade service in the homes, including day service, and the facilities resemble institutions of other types such as Willowbrook, where abuse had been uncovered. Board and care homes were the subject of exposures of lacking medical personnel at the time of the 1990s reviews. Nursing homes have been the subject of decades of effort by the state and at the national levels to reform health and residential care for frail elders, especially those with lower income in the US. Regulations have been added to assure that basic good care, example, accepted good human standard, will take care in these facilities. Examples such as personal, education, activities and service, ancillary and professional service, advocacy and reviews. So I will pass to Alip for the further information. That's all from me. Please welcome Alip. Please.
Okay, thank you to Kamarul. Okay, my name is Muhammad Ali bin Abdul Aziz, H17A0113. I will continue his explanation in introduction. Okay, a major nursing home reform initiative occurred in 1996 when the Healthcare Financing Administration studies its own facilities and report to the US Congress on the effectiveness of its current system and certification of nursing homes. By 1998, the President announced new steps for federal oversight, including monitoring of poor performance, collection new fees, and increased focus on nutrition and basic personal care like pressure salt. By year of 2000, minimum staffing ratios and implementation of nursing home quality of care were introduced. This action followed by Omnibus Budget Reconciliation Act of 1987. The Centers for Medicare Services in the Department of Health and Human Services now publish the nursing home data compendium annually, which show various statistics related to nursing home and residents, as well as health deficiencies, and substandard care. The result of the 2015 edition were generally positive, showing the decrease of substandard care report from 4.4% in 2008 and 3.2% in 2014, reversing a previously increasing trend. In general, nursing home means the protection, promotion and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through diagnosis and treatment of human response and advocacy in the care of individuals, families, communities and population. In other side, nursing home is also known as long-term care center, convalescent home, skilled nursing facilities, care home, rest home, intermediate care and old folks home. Nursing home is also a residential facility for people with chronic illness and disability, particularly older people who have mobility and eating problems. Regarding to the task, we are assigned to pick a country and identify the law and certification of nursing home in global. We decided to choose United States of America. The reason why we choose this country because according to the statistic, United States of America is one of the country that has the best elderly care or nursing home in the world. United States of America has met 28 of 50 best institutions of elderly care in the world with life expectancy at 78.9 years. Okay, next I will pass to my friend Atika for the further explanation. Thank you.
So, thank you to the first presenter. Hi, my name is Atika Shadamiti Abdurrahman. So, I will talk about law of nursing home in USA. Congress passed legislation in 1987 requiring nursing home involved in Medicare and Medicaid to comply with certain quality of care rules in response to allegation of systematic neglect and violence in nursing homes. So, this legislation known as Nursing Home Reform Act, which nursing home must provide facilities and activities in compliance with the written care. Other than that, nursing home must comply with the federal standard for the long-term care facilities in order to participate in Medicare and Medicaid. Under federal nursing home regulation, nursing home must have few rules, which is must have sufficient nursing staff, develop for each resident a detailed care plan, prevent a degradation of the ability of residents to bath, clothe, groom, move and ambulate, shower, feed and interact. Other than that, provide requires facilities to ensure proper diet, grooming and personal oral hygiene, ensure that residents do not develop pressure sores, offer the appropriate care and resource if residents develop pressure sores to facilitate recovery, avoid infection and prevent the formation of new sores. Nursing home that collecting funding from Medicare and Medicaid must comply with the regulation. So I'll pass to the next presenter.
As Atika Shahada mentioned previously, the law exists to safeguard nursing home residents' care. However, my concern is on what are the impact of this law towards nursing home elderly and employee, and how the law are able to protect the resident. In general, the content of the law is to protect the right of nursing home residents to live free from abuse and neglect. The regulation promotes respect and dignity for each of residents, minimum safety requirement, minimum staffing requirement, receive proper nutrition, social involvement, mental support, emotional support, personal hygiene, and some of others rights to which the residents are entitled, such as proper health care like dental care and primary day care, social service related to medical needs, privacy when requested, such as privacy on personal matter and financial matter, proper treatment that does not involve violence, and also prescribing. The first impact is a better elderly well-being care. When residents come to nursing home, they receive a written plan of care personalized to fit their specific need. The plan needs to cover all the needs of the patient, include psychological, nursing, and medical needs. The plan also needs to indicate how the facility plan to meet the needs of the patient. The next impact is social service related to medical needs. Upon entry to nursing home, they undergo a health assessment. And the assessment continues daily for the length of the staying period. The patient's doctor and the nursing home staff will evaluate the patient's physical and mental health. They also will evaluate the medication, the ability to manage the daily tasks, and also they also will evaluate the ability to speak and make decisions. This assessment used to plan a better treatment and also to evaluate their patient progress, and also to determine the ongoing the medical care coverage for the patient. Nursing home residents are allowed to participate and weigh in on their care plan. If they are not capable of doing so, someone that they trust, such as adult or their child or siblings, can participate on their behalf. The third impact is proper treatment that does not involve violence. Federal law protects nursing home resident rights to be treated with dignity and respect, which include making decisions such as what time to go to bed, what time to get up, what times to eat meals, and what activity they are preferred to do during the day, as long as this decision does not conflict with the daycare. And the next impact is prescribing. Nursing Home Reform Act of 1987 established strong legal protection on the right of people in nursing home. Before Nursing Home Reform Act, psychotropic drugs were used widely in U.S. nursing home. These drugs were prescribed for 43% to 55% of the patient in nursing home, despite the lack of documentation that justifying why they use the drug. The last impact is the impact towards employee. Research by Hare and Pratt in 1988 has shown that higher level of nursing burnout in both acute and long-term care setting may be related to the nature of physical and emotional strenuous work tasks that have been done by employee, and also low status in comparison to other positions in the healthcare system, could be limited training, and also could be low wage and benefits, and poor staffing to the patient ratio also could be the source of the stress among nurses. Although strong federal quality standards were established by law in 1987, the crucial important standard for staffing continued to be weak. Due to the reason, I will let Shazwani Aida to briefly explain on certification of the employee in nursing home.
Assalamualaikum warahmatullahi wabarakatuh. I am Shazwani and I'm going to present my part, which is certification of personnel. Credentialing is a process to assess an individual, program, institutions, product has met the requirements set by a government and non-government agent. It is important to establish the qualification of licensed medical professional and assessing their background and legitimacy. Certification of home care personnel consists of administrative, home health aide, personal care attendants, registered nurse, and social work assistants. Certified Nursing Assistants (CNAs), Licensed Practical Nurse (LPNs), and Registered Nurse (RNs) play an important role in nursing home environment. State survey agencies are responsible for both licensing nursing facilities that comply with state legal standard and certifying those who meet the requirement for Medicare and Medicaid programs to participate. Certified Nursing Assistants (CNAs), often referred as nurse aide or patient care assistant. CNAs have a different and more skilled role to play in nursing home environment. Employees are commonly assigned with patient assessment. In order to ensure workers do not work outside their area, facility managers are keenly aware of the rules. In order to ensure basic standard of quality and safety for residents, surveyor performs on-site survey of licensed nursing home annually. I think that's all from me. Thank you for lending me your ears. I will pass to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Nadiah binti Rahizal. My matric number is H17A0228. Today I will present my part, which is the development of the certification of the personnel. First, Certified Nursing Assistant (CNA) is one of the fastest growing occupation that requires some post-secondary education but not degree. Nursing assistants are support workers who provide basic patient care such give feed, bath, dress, groom or move the patient. Not only that, CNAs take care of people who have a chronic problem, terminally ill patient, elderly or have a disabilities. For your information, working as nursing assistant in a long-term care facility complete a state competency examination and be placed on the state registry of nursing assistant. A person who are working as nursing assistant need through minimum competencies for training program, which must be at least 75 hours, including 16 hours of clinical or practical skill under supervision of a registered nurse. Training for this position typically take 1 or 2 years and in some cases confers an associate degree. Next step in the pathway is to become a registered nurse (RN) through either a 2 years associate degree in nursing or 4 years Bachelor of Science in Nursing (BSN) degree, as well as a corresponding required license exam. Lastly, RN is direct caretaker for patients in the hospital, managing patients like take care of daily activities, medication, assessment, and schedule procedure and operation. This because while RN work closely with fellow healthcare staff and physicians to ensure they know about and understand patient updates and care plans. That's all from me. Thank you.
My name is Syaira binti Zafranan. My matric number is H17A0368. I will continue for benefit of the law and certification of the USA. There are some benefits shown. Firstly, certification qualification. It is very important to people who work at hospital, especially nurse. This is because nurse the people who will manage the patient while the patient work in the hospital. The hospital must prioritize the people or nurse who have the certification qualification because they know how to treat the patient very well, and as usual, they know how to control their temper. Next, certification can contribute to better patient care. This nursing certification not only demonstrates high specialization and efficiency, but it also allows the nurse to provide the best possible care. Certification helps nurse have the knowledge and skill, as well make good assessment and ensure patient safety. It also gives more opportunities for education and long-term progress. Last but not least, authority and responsibility of nurse is one of the major contributor in the field of the medicine, especially treating and monitoring the condition of patients in nursing home, clinic and hospital. So, they can work in any situation and different group if they are qualified. I will pass to Ain.
As the conclusion, the nursing home sector is one of the most heavily regulated industry within the USA country. So the law requires sufficient nursing staff in order to provide nursing and related services to attain or maintain the highest practicable level of physical, mental and also psychological well-being of each resident. So due to that, increase in education level and also training of nursing staff are strongly recommended as a step to improving quality of care and also reducing the turnover rates in nursing home. So that's all from us. Thank you so much.